today we're talking about one of my favorite new joint and soft tissue mobilizations, which is a knee flexion mobilization using a lacrosse ball. So this is going to get both the knee joint as well as the actual soft tissues around it. So if you're one of those people who does a workout and your knee feels a little stiff afterwards, a little sticky, maybe a little bit of pain, this is one of the best things you can try doing. Again, this is not a fit for everybody. Some people will get really good results with this, other people not so much. But this is definitely something you can try. So what we're gonna do, we're gonna take our lacrosse ball and we're gonna do both sides of the joint. So I'll show you on my left leg first. So I'm gonna cram this lacrosse ball up into my hamstring and calf muscles and really into those tendons as much as I can. You wanna make sure it's up under the knee enough so that it's not gonna go sliding out. This does a little bit better on your actual skin than it will over pants or leggings, but this is what I got on, so we're making it work. So with this, you're gonna jam it in between and then just slowly bring that knee up into flexion. And you wanna get to where you definitely feel that, that tenderness and that tightness. For me, all these tissues are pretty sensitive because I run and so they get really tight. So you're just gonna kind of slide that heel up to where you can tolerate it. You want it to be like that hurt so good kind of feeling. And then we're just gonna hang out here for a little bit. So you can sit here. You always wanna lean back against something just to make it easier to pull that knee up. And as you're sitting, as those tissues start to loosen up a little bit, it may get a little bit more comfortable. So then you can pull in a little bit tighter. While you're here, if you can tolerate it, you can kind of move that ankle around. So you can pump it up and down. You can rotate in and out, and that'll change what you feel too. So for me, when I rotate out, it's pretty miserable. And when I pull up, I really feel that tightness and that pain, which makes sense because I have a lot of calf tightness. So you can kind of move around in that, or you can just hold a static hold here. So I would hold for 2 or 3 minutes with it on the lateral side or the outside, and then I would switch to the inside as well. So I'm going to show you on my right knee for the inside of the knee. So same thing here, we're going to kind of tuck it up in between that hamstring and the calf. You want it to be in a little bit more of the meaty sections if you can, just so it'll stay. And then we're going to gently pull up, find that spot where it's pretty tight, but it's still tolerable, and where you feel that good pressure. So if you have a really, really stiff knee that doesn't want to flex very far, this can help with that. So because it's up in so close to the knee joint, we're going to get a little bit of gapping in between that tibia and the femur. And then we're also getting a little bit of tissue mobilization to the calf and also to the hamstring as well. And then all of those kind of fascial layers are getting stretched and pulled a little bit. So we're really just kind of helping that mobility overall. So you may find that one side feels better to you than the other. One side may be a little bit more sore, and that's probably where you need to work on the most. But you can do the same thing here. So bring it up to where it feels nice and tight. Move that ankle around. You can try doing some tibial rotation as well as rotating the foot. So that's going to affect both the muscles and the joint alignment too. And then rotating out. For me, rotating out, I feel the most. So that's where I would kind of hang out and work on the most. So if all you can do is just keep the pressure there, that's fine too. You can just kind of do that. And over time, as you get less and less sensitive, you can kind of work into those other mobilizations at the same time. So try this out, see what you think. If you're having any kind of knee pain with running or cycling or any other activities, squatting, lunching, going up or down stairs, give us a call at Peak Performance. I'd love to help you get back to the things you love.